One of my first key responsibilities will be trying to bring all the people together. What do I mean by that? All researchers, all scientists, everybody who is involved in the medical oncology field, medical doctors, nurses, psychologists, dietitians, everybody who is involved against the fight in the fight against cancer should come together, because I believe only together we will be able to achieve results and move forward with the agenda on the African continent. If we take in consideration the statistics and the estimations done by the Global Canon IARC, in 2012 we had more than 8 million deaths caused by cancer. And we all know and we all acknowledge the fact that cancer is a leading cause of death globally. And again, we know it's a well-known fact that more than 70% of all cancer deaths occur in low mid-income countries. So in this context, obviously we need to have a plan of action in order to move forward with the fight against cancer on the African continent. So the challenges are related by the fact that this continent will be overwhelmed not only by cancer but by an existing number of other diseases. So in a context where infectious diseases in the sub-Saharan Africa, still HIV, still TB, infectious diseases such as malaria, in the context of poverty and really people trying to deal with the common diseases, cancer needs to be acknowledged. We need to increase the awareness and we need to bring that to the attention of all. So in order for us to really estimate the burden of disease, we need to have the data. So one of the priorities will be to invest in cancer registries and not work only on estimation. I have been the chair of the pediatric cancer registry in South Africa, and I coordinate the activity of the childhood cancer registry on the African continent, and we do have a hub of the IARC, of the International Agency for Research on Cancer, which deals with about 21 registries at the moment, and it's called AFCRN, so that is basically the African Registry Network Group. Amongst the new things or innovative ideas that I would perhaps bring to the organization, I would definitely like to increase the visibility of the organization, to increase the number of members. More and more members should join AORTIC, as it will give us more strength working together. And one important thing which is really very close to my heart is to concentrate on the young population. So the young population, bringing the young scientists and bringing the young researchers, building up the capacity. African continent is one of the youngest continents in the world. Almost half of the population is represented by young people, and I believe in young people, so I would really like to concentrate on having more and more young scientists and of course women as well, and researchers to be part of the organization. A third of the cancers described in Africa are caused by infections. That makes it completely different than the other cancers happening in the rest of the world. So yes, definitely diagnosis, yes, definitely treatment, but the priority, the key will be on prevention. How can we prevent? Because there are certain type of cancers which are preventable. That will be one, and definitely for those which we cannot treat, the very advanced, the very metastatic cancers, definitely to offer the support to the patients in terms of palliation. So, pain relief and palliation to the patient.